Welcome to MitoCast by Mito Foundation. We share information and resources to support people with Mito, their families, and the wider community. All content is created by Mito Foundation. AI text-to-voice technology is used only for the production to make our resources easier for everyone to access.
Does this sound familiar? Heavy eyelids that seem to sink lower as the day goes on. Eyes that won't quite move the way they used to. Maybe you're turning your head more to look up or to the side, or noticing that nighttime vision is becoming harder. When those pieces come together, one possible explanation is a rare type of mitochondrial disease, Mito for short, called Kearns Sayre syndrome, often shortened to KSS.
Even hearing that name can land with a thud. If someone has just been told Kearns-Sayre syndrome, what are the first things they need to understand without getting lost in medical language?
Start with this. KSS is one of many different types of mito. Mito is what we call it when mitochondria, the tiny parts inside our cells, don't work properly. Mitochondria are responsible for making energy in your cells. And when they can't produce the energy your body needs, it can be hard for different body parts, like muscles or the brain, to work the way they should.
So KSS is an energy problem that shows up in particular ways. Is that why it can affect more than one part of the body at once?
Yes. In people with KSS, the brain, nervous system, and muscles are commonly affected. And because different body systems rely on energy, KSS is described as a multi-system disorder, which means it can present differently in different people.
When people say multi-system, it can feel like a blank check for anxiety. Can we ground it in what KSS is actually defined by?
We can. KSS is defined by 3 features. Symptoms starting before the age of 20, a condition called chronic, progressive, external ophthalmoplegia, and changes in the back of the eye known as pigmentary retinopathy. And on top of that, people with KSS also have at least one of several other conditions.
Chronic progressive external ophthalmoplegia is a mouthful. What is that in plain language?
It means the muscles that move the eyes gradually become weak. External refers to the eye muscles that move the eyeball, and progressive means it tends to worsen over time. The result is impaired eye movements. So a person might find it harder to look up, down, or side to side, and may turn their head to see in different directions.
And that is where droopy eyelids fit too, right? Ptosis?
Exactly. Ptosis is drooping of the eyelid. With KSS, drooping eyelids can be part of the picture, alongside the reduced eye movements. Those changes can be subtle at first and then become more noticeable.
What about pigmentary retinopathy? That sounds like something you might only discover during an eye exam.
It often is found during an eye exam, but it can affect daily life. Pigmentary retinopathy is damage to the retina, the part of the eye that senses light. The damage can cause abnormal coloring in the retina that can look like a salt and pepper pattern. And over time, it can lead to poor night vision and progressive loss of peripheral vision, which is the vision out to the sides.
You mentioned that KSS is defined by those 3 features, plus at least one more condition. What are the plus conditions?
They include heart issues known as complete heart block, high protein in spinal fluid, trouble with balance known as cerebellar ataxia, short stature, hearing loss, dementia, or endocrine disorders, meaning hormone-related conditions.
Let's pick one at a time. Complete heart block sounds serious. What is it in everyday terms?
Heart block is about the electrical signals that control your heartbeat. In heart block, those signals slow down or get blocked, and that can lead to dizziness or fainting. Because of that risk, heart monitoring and heart care are a key part of living with KSS.
And cardiomyopathy is mentioned too. How is that different?
Cardiomyopathy affects the heart muscle itself. It can weaken and enlarge the heart muscle, making it harder for the heart to pump blood. Symptoms can include shortness of breath, and fatigue.
I'm hearing eyes, heart, balance, hearing, hormones, brain. It makes sense why people might feel like they're juggling a lot. Is it common to have all of these at once?
Not necessarily. KSS can look different from person to person. The defining features anchor the diagnosis, but the rest varies, and that variability is part of why care tends to involve a team with different areas of expertise.
How rare are we talking?
KSS is described as rare, and the exact prevalence is unknown. The information available suggests estimates vary, with some sources suggesting around 1 to 3 people per 100,000, and others suggesting around 1 per 100,000. The big takeaway is that it's uncommon, and many people find it helpful to connect with clinicians and services that have experience with Mito.
Okay, now we are stepping into genetics. When the page says genetic changes that affect metabolism, what does that actually mean?
Metabolism is how the body converts food into energy and removes waste. That process relies on hormones and enzymes to run smoothly. When a genetic change disrupts that process, it impacts mitochondrial function, and then the body can struggle to produce the energy it needs for different organs and tissues to function well.
And the eye muscles are singled out as particularly affected. Why?
In KSS, the eye muscles are described as particularly affected because they contain many mitochondria and are more sensitive to these genetic changes. So when energy production is disrupted, those muscles can be one of the first places where day-to-day changes show up, like drooping eyelids and difficulty moving the eyes.
So, what kind of genetic change is most common in KSS?
The common genetic change listed is a mitochondrial deletion, meaning a missing segment in mitochondrial DNA. The size and exact section missing can vary from person to person.
There's another concept that can be confusing. It says the deletion may not be found in blood tests and other samples might be needed. Why would a genetic change hide like that?
Because the mix of healthy and changed mitochondria can be uneven across the body. One organ might have a higher proportion of changed mitochondria than another. That uneven distribution can mean a blood sample doesn't show the deletion, even if it's present in tissues like muscle.
That uneven mix has a name, doesn't it?
It does get referred to as heteroplasmy, which simply means a mix of healthy and changed mitochondria in different amounts in different tissues. The practical point is that if blood testing is negative, but KSS is still suspected, other samples, including muscle or sometimes skin, hair, or urine, may be considered.
And then there's the inheritance question. People hear mitochondrial DNA and immediately think passed down from mum. Is KSS always inherited?
This is where it helps to slow down. The information notes that many people with KSS have DNA changes in mitochondria, and mitochondrial DNA is inherited from our mother. At the same time, it also states that generally, KSS is not inherited. That can sound contradictory, and it's one reason genetic counseling is emphasized to help interpret what a person's results mean for their family.
So the safest takeaway is genetics are involved, but family patterns can be complicated, and you don't have to figure it out alone.
Exactly. And it also notes that, in rare cases, factors other than mitochondrial DNA deletions can cause KSS, and those cases follow the inheritance pattern of the specific gene involved.
That's where nuclear DNA comes in?
Yes. If the genetic change is in nuclear DNA, meaning the DNA we inherit from both parents, the information notes that both parents must carry it for a child to be affected, which is called an autosomal recessive pattern.
All right, let's move into diagnosis. If someone suspects KSS, how do clinicians actually go from symptoms to a diagnosis?
A diagnosis for KSS is based on your history, your signs and symptoms, a physical examination, and other testing. The physical exam includes checking the eyes and nervous system. That can mean testing eye muscles, the ability to focus on targets, and moving the eyes in different directions, and also measuring ptosis.
So it is not just one test, it is a pattern plus tests that support the pattern.
That's right. And clinicians may refer for additional testing. One possible test is a muscle biopsy, where a small sample of muscle is examined under a microscope to look for ragged red fibers, which are a sign of some types of mito, including KSS, that may not be detectable in the blood samples.
Ragged red fibers is an evocative phrase. What does it actually tell you?
It tells the team that the muscle tissue shows changes consistent with certain mitochondrial conditions. You don't need to visualize the microscope slide to understand the purpose. It's a way of looking directly at tissue changes when blood tests might not give a clear answer.
And what about blood tests? What are they looking for?
Blood tests may measure substances like lactate and pyruvate. High levels of these can signal KSS. Blood tests can also be used to rule out other conditions by looking for a lack of specific antibodies, including antibodies relevant to myasthenia gravis and thyroid-related eye problems.
So that helps avoid misdiagnosis because droopy eyelids and eye movement changes can happen in other conditions too.
Exactly. The goal is to build a clear picture and exclude other explanations. Another test mentioned is a lumbar puncture, which is a procedure that allows health professionals to check the fluid around the brain and spine. It may be used because many people with KSS have high protein levels and/or low levels of folate in that fluid.
That's helpful to know because people might hear lumbar puncture and assume it's random, but it's connected to common findings in KSS.
Yes, and because heart involvement can be part of KSS, tests like an electrocardiogram, which checks heart rhythm, and an echocardiogram, which looks at heart muscle function, may also be required.
Now, genetic testing. A lot of families hold their breath for genetic results. What is the approach described here?
If a doctor suspects KSS, they will arrange genetic testing to look for changes associated with the condition. Genetic testing for mitochondrial deletions is specific and is known as next-generation sequencing. It's described as a modern method that reads the order of DNA or RNA in a sample, sequencing many strands at once, which makes it faster and more efficient than older approaches. It's also described as the best method to find large deletions in mitochondrial DNA from blood samples. And if blood testing is negative but KSS is still suspected, other samples, including muscle or sometimes skin, hair, or urine, may be considered.
Waiting for results can be emotionally heavy. Do they say anything about timeframes?
They do. Genetic testing is described as highly specialized, and it may take up to 3 to 4 months to receive results. Genetic counseling is noted as important to discuss what results mean for you and your family.
Once you have a diagnosis, the focus shifts. It's less what is this and more how do we live with it? What does the recommended approach look like?
It emphasizes that you'll likely need a team of health professionals. Your general practitioner, or GP, is described as a main point of contact who can help with referrals and tests and coordinate care. From there, the team may include a neurologist, an ophthalmologist, an orthoptist, a cardiologist, an endocrinologist, a metabolic specialist, a genetic counselor, an audiologist, a physiotherapist, a speech therapist, an occupational therapist, and mental health support.
That's a long list, and it can feel like you're being asked to become a project manager overnight.
It can help to remember the list is a menu, not a checklist. The idea is to build support around the areas that matter for you and let your GP and the wider team help coordinate the moving parts.
Now, there's a section about emergency care, and I'm glad it's there because people impacted by Mito often worry about what happens during a sudden illness.
Emergency care is covered clearly. If your mito specialist thinks you're at high risk of sudden illness, they should give you an emergency plan. That plan should include your diagnosis and clearly outline which tests and treatments are recommended for you.
And there's also a practical step that doesn't require medical knowledge, keeping details current.
Yes, it acknowledges it's hard to plan for emergencies, but says you can help by making sure you have up-to-date details of your main care team, including your GP, mito specialist, and other health professionals who know you best. It also notes that the Australian patient care standards for mito and important information about medicines can give treating teams extra information, especially if they're not familiar with mito.
So, in an emergency department, instead of trying to explain everything while you're unwell, you have something that speaks for you.
That's the intent. And in the Watching for Serious Illness guidance, it specifically highlights monitoring lactate levels during a sudden illness. Lactate levels refer to the amount of lactic acid in your blood. Elevated levels can be harmful, and monitoring serum lactate can help the healthcare team intervene early to reduce the risk of serious illness.
Let's talk about eye care, because for many people, that is where day-to-day impacts are most obvious.
Eye care is described as essential if you have eye symptoms of KSS. A thorough assessment includes checking visual acuity, assessing visual fields, examining eye movements, and assessing drooping eyelids. If vision is impaired, it suggests considering a low vision specialist.
And what about ongoing monitoring? Is it a once-and-done situation?
Annual visits with an ophthalmologist are recommended for ongoing monitoring. Those visits involve checking for changes in vision, checking the health of the retina and macula, measuring intraocular pressure, and evaluating the health of the optic nerve.
And there's also a comfort piece, which can be overlooked. What if it's hard to close your eyelids?
If it's difficult to close eyelids due to ptosis or after ptosis surgery, methylcellulose eye drops or ointments are suggested to keep eyes lubricated.
Surgery comes up too. That can be a big decision.
It notes that surgery might be necessary for conditions like strabismus, which is eye misalignment, ptosis, or cataracts, meaning clouding of the lens. The focus is on assessment and the right specialist input, rather than rushing into anything.
Okay, shifting to muscles. The word myopathy gets used a lot in mito. How is it framed here?
Myopathy means muscle problems, often including weakness. The guidance mentions being proactive about health, and it also notes that in case of muscle breakdown due to exercise or illness, known as rhabdomyolysis, there are standard treatments to follow.
That's a scary word, rhabdomyolysis. But it's helpful to know there are standard treatments, and it's not just good luck.
Exactly. And it then talks about staying active in a balanced way. Exercise is described as beneficial, but it should be tailored to your needs and capabilities. Before starting an exercise program, heart function should be checked to ensure it's safe.
And physiotherapy is part of the picture.
Yes, physio and regular assessments can help maintain mobility and prevent complications. For a personalized exercise plan, it suggests speaking with a professional, such as an exercise therapist or physiotherapist. For children, exercise should be tailored and supervised by heart specialists and physiotherapists.
That naturally leads into heart care. What does the recommended heart checkup look like?
It suggests an initial heart checkup that can include an electrocardiogram, often referred to as an ECG, which can sometimes monitor for over 24 hours, and/or an echocardiogram. Annual electrocardiograms are described as important to monitor heart health, and the frequency of other tests is personalized based on specific needs and family history.
And if irregular heartbeats show up, a pacemaker is mentioned.
Right. For irregular heartbeats, called conduction defects, treatments and procedures are available, such as a pacemaker, to help regulate heartbeat. It explains a pacemaker is a small, battery-powered device surgically implanted, usually in the chest, that sends electrical signals to make sure the heart beats at the right pace.
Now, endocrine conditions, hormones can feel like an invisible layer of health until something goes wrong. How does KSS connect to endocrine problems?
It says endocrine problems can be the first symptom of KSS before other neurological symptoms show up. It notes these symptoms happen in 35 to 67% of people with KSS and can include diabetes mellitus, short stature, low sex hormones, adrenal insufficiency, and low parathyroid hormone.
Can we translate those into what people might notice?
Sure. Diabetes mellitus is described as difficulty controlling blood sugar levels, leading to high or low blood sugar. Short stature is described as being shorter than usual because the body doesn't make enough growth hormones needed for normal growth. Low sex hormones, called hypogonadotropic hypogonadism, is described as not making enough sex hormones due to issues with the brain's hormone signals, which can affect puberty and fertility.
And adrenal insufficiency?
Adrenal insufficiency is described as the adrenal glands not producing enough hormones like cortisol, leading to symptoms like fatigue, weakness, and low blood pressure.
And low parathyroid hormone affects calcium, right?
Yes, low parathyroid hormone, called primary hypoparathyroidism, is described as the parathyroid glands not making enough hormone to regulate calcium levels in the blood, which can cause muscle cramps, tingling, and other symptoms.
It also says these conditions can often be treated, which matters because another problem can feel hopeless.
Exactly. It notes that doctors who specialize in hormones, endocrinologists, will monitor for these conditions and check for them regularly because they can often be treated. It also includes a practical point about diabetes. Managing blood sugar within your target range can help prevent nerve damage and other diabetic-associated conditions.
Let's talk about hearing. Hearing loss can creep in quietly, and people might not link it to Mito straight away.
Hearing loss is listed among the possible features, and it explains that sensorineural hearing loss is a type caused by damage to the inner ear, or the nerves that send sound signals to the brain.
What's the recommended approach for monitoring hearing?
Regular hearing checks are described as essential, especially for children who might need extra tests. Assessments should be done initially, and then every 1 to 2 years.
And there are two practical cautions: noise and certain antibiotics.
Yes. It says avoid loud noises to prevent worsening hearing loss, which might not be reversible. And it notes some antibiotics, like aminoglycosides, can worsen hearing loss.
If hearing loss is present, what supports are mentioned?
It notes that monitoring hearing closely during serious illnesses or acute episodes is important. Digital hearing aids can help with moderate to severe hearing loss, and cochlear implants might be an option for very severe cases. It also notes hearing loss can affect speech and learning, especially in children.
There are also a couple of other signs mentioned that don't always get airtime: swallowing and muscle tone.
Yes. Other signs and symptoms include dysphagia, meaning swallowing difficulties, and low muscle tone, called hypertonia. Those are areas where a speech therapist and physiotherapist may be part of support, especially if swallowing or mobility is affected.
And for children, there is a whole section that's really about development and learning.
For children with KSS, monitoring developmental progress and cognitive status is described as important. It mentions tools like the Griffith scales can provide valuable insights during early developmental stages. As children reach 6 years of age, regular neuropsychological help is described as needed to customize care plans, with monitoring every 2 years or more frequently if there is a change in cognitive abilities or behavior.
And if changes show up, the advice is to bring in the right supports, including school support.
Yes, If you see new symptoms or changes in a child's development, it encourages speaking with a health professional. A referral to a developmental pediatrician and other health professionals can be considered, and those professionals can work with the child's school to support growth and development.
There's also a strong statement about mental health, and I'm glad it's not treated as an optional extra.
It says taking care of mental health is just as important as managing physical symptoms when dealing with KSS. If someone has psychiatric symptoms such as anxiety, depression, or memory loss, it encourages speaking with a health professional. For children, it highlights watching for low self-esteem and anxiety, and that addressing those feelings early can make a big difference in emotional well-being.
Now, medicines. This is an area where people want certainty, but the reality is nuanced. What does the guidance actually say?
It lists medicines to be used with caution, noting certain medications can affect muscles. These include statins for high cholesterol, metformin for blood sugar control, corticosteroids for inflammation like asthma, and antiretrovirals for viral infections, such as HIV. The key message is they should be used with caution, and if prescribed, regular monitoring is crucial to avoid worsening myopathy.
And then there are two specific seizure medication notes.
Yes. It notes that if someone has optic atrophy or mitochondrial DNA depletion syndrome, a seizure medication called vigabatrin should be used with caution. It also notes that valproate, used for managing seizures, may be harmful and is contraindicated, especially for those with POLG genetic changes, due to the potential to worsen seizures and the risk of liver failure.
That is one of those places where people really benefit from personalized advice, because you don't want listeners changing medicines based on a podcast.
Exactly. The purpose of sharing this is to support informed conversations with the treating team, not to prompt changes without clinical guidance.
Supplements are similar. People hear about supplements and feel pressure. What is actually stated?
It says there are reports that certain supplements might help people with KSS, including coenzyme Q10, carnitine, thiamine, riboflavin, magnesium, orotate, and alpha-lipoic acid. However, it also notes there isn't enough evidence to prove these supplements are beneficial for everyone with KSS. Before starting a new medication or supplement, consult with your health professional.
There's a short personal story included, and I think it's useful because it reminds listeners they're more than a diagnosis.
The story is about Victor, a 22-year-old living in Bulgaria with KSS. Diagnosed at 14, he's described as facing each day with determination and humor. It mentions he does physio 5 times a week, swims on weekends, and sticks to his treatment routine because he believes in his future.
It's important to say that's one person's story. It's not a template, but it can still offer something.
Exactly. It can be a reminder that routines can be built around your own capacity, that joy and effort can sit side by side, and that living with KSS doesn't have to mean your identity is reduced to symptoms.
Now, community support. If KSS is rare, people often ask, where do I find others who get it?
The information notes that as of June 2025, no active support groups dedicated to KSS were found in Australia. It does list online groups, including a Mito support community, and also groups based in the United Kingdom focused on CPEO and KSS. Even when a diagnosis-specific group isn't available locally, many people find value in connecting with the broader Mito community.
And there are support services linked through the Mito Foundation too.
Yes, there's a helpline described as a place to call for general advice, assistance in seeking a referral, or more information on support services. There are also events that bring together people impacted by Mito. And for disability support, it mentions an NDIS navigation service offering resources, education, and one-to-one guidance on the NDIS.
So let's talk about clinical studies, because for some people, research is a form of hope, and for others, it's just not right now. What is offered?
It says the Mito Foundation supports people impacted by Mito to participate in clinical studies, including facilitating access to relevant studies such as clinical trials. It explains that clinical studies are an essential part of developing new ways to prevent, diagnose, treat, and cure Mito.
And joining the Mito registry is specifically suggested.
Yes, it suggests joining the Mito registry to stay informed about opportunities to take part in clinical studies relevant to you. It also mentions there are registries of clinical trials underway in Australia and globally, which can help people find clinical studies.
Okay, we've covered a lot of ground, but I'd love one moment of clarification. What is the single center of gravity of KSS, the thing that ties everything together?
The center of gravity is that KSS is a type of mito, and mito is fundamentally about mitochondria not working properly. When mitochondria can't make enough energy, systems that need steady energy, like eye muscles, the heart, the brain, and muscles, can be affected in different combinations.
Let's do one quick myth versus fact, because inheritance comes up so often and can bring guilt or blame into a family.
A common myth is, if mitochondrial DNA is involved, KSS must be passed down through the family. The fact described here is more nuanced. Many cases involve genetic changes in mitochondrial DNA, and mitochondrial DNA is inherited through the mother. Yet the information also states that generally KSS is not inherited, and in rare cases, nuclear DNA genetic changes may be involved, with different inheritance patterns. That's exactly why genetic counseling is highlighted as part of good care.
Now, a practical what you can do next section, but let's keep it grounded in what is actually supported. What are a few concrete next steps mentioned?
If you are at high risk of sudden illness, ask your mito specialist about an emergency plan that includes your diagnosis and the tests and treatments recommended for you. Keep up-to-date details for your main care team, including your GP and specialists, so they're easy to share in urgent situations. And consider building your monitoring routine around the areas highlighted here: eye care, heart care, hearing checks, and hormone checks tailored to your needs.
And on the support side, there are action steps too, not just medical ones.
Yes, if you want connection or guidance, the helpline is there for general advice and support, including help-seeking referrals. Events can be a way to meet others impacted by Mito. If you're navigating the NDIS navigation service is mentioned as a place for resources and one-to-one guidance. And if research participation feels right, joining the Mito registry can help you stay informed about relevant clinical studies.
Before we close, could we do a brief recap, just to help listeners file the key points?
Kearns-Sayre syndrome is a rare type of Mito that usually starts before age 20. It's defined by progressive weakness of eye movement muscles, pigmentary retinopathy, and early onset, plus at least one other feature such as heart block, balance difficulties, hearing loss, dementia, short stature, high protein in spinal fluid, or endocrine disorders. Diagnosis draws on history, exams, and tests, and care is usually supported by a team approach.
And the tone I want to leave people with is, it's okay if this feels like a lot. Complexity isn't your fault.
Exactly. The goal isn't to memorize everything, it's to recognize patterns, know what kinds of monitoring and support exist, and feel empowered to ask for the right help at the right time.
You've been listening to MitoCast by Mito Foundation. To learn more or find support, visit mito.org.au or call our helpline on 1300977180. Make sure you follow MitoCast wherever you listen to this podcast to help us spread the word by sharing it with others impacted by Mito. Thanks for listening.